Hi, y'all. I am Dr. Lauren Chase. I'm really excited to be talking to y'all today about mental load. This is going to be a really great conversation in partnership with Queen City Doula to talk about mental load. And we're going to kind of have a conversation about what that looks like from the perspective of me as a mental health therapist and Suzanne as a doula. And I'm really excited to have this conversation with y'all, and hopefully we'll gain some new information and get different perspectives on an issue that I think isn't talked about enough.
I agree. Yeah, thank you. So I'm Suzanne Wentworth, and I'm a nurse, but I've also been working with moms and babies for about 30 years. So I'm dating myself there, but I have a lot of experience with moms, especially in the home care setting when they get home with their new babies. And this is definitely something that I think is starting to be talked about a little bit more, but for a long time, I think that people haven't really been talking about it, and we'll get into some of that, why moms tend to kind of keep it to themselves and not say anything, and then they're struggling. And so this is a great opportunity for us to talk about just what that mental load of motherhood is, and some things that we can give you to take away to kind of help yourselves if you're in that position, or if you're getting ready to have a baby, just how you can anticipate some of the changes that are going to happen and how to be more proactive.
Definitely, definitely. Let me introduce myself here. I am Dr. Lauren Chase. I am owner and clinician at Climbing Hills Counseling, where I specialize in providing responsive mental health counseling online. I specialize in working with new moms and parents throughout the parenting journey, whether you're brand new moms or your kiddos are in elementary school or they're out of the
Oh,
house, really
nice.
providing support throughout the whole life cycle there. I'm a former child therapist, so I did child therapy for many, many years. And I take that information that I learned about child therapy and I apply it to working with moms and supporting them in more effective ways and helping them focus on themselves for a little bit.
Awesome. Yeah, so that's great. And I think that that will be really nice to tie into our conversation, because I think even just the title, if you wouldn't mind, Dr.
Mm,
Chase, just what does that mental load mean in kind of the psychological terms?
absolutely. So the mental load, when we describe that in therapy, it's a lot of just these unspoken things that we have to do, right? It's keeping up with the doctor's appointments for kids. It's keeping up of when they need their shots. It's keeping up with all these different pieces in our world. I always kind of describe them as just bouncing balls. And we're like juggling, and it's a different ball, whatever that may be. Maybe this kiddo needs to go to the doctor's. Maybe there's, a thing going on in school. And I think a lot of the mental load is just all those tasks, and whether that's an appointment, whether that's laundry that needs to be done in the house, something that takes up space in your mind related to your family, your life, and that just all kind of encompassed in that mental load.
Yeah, I think that's a really good point. And I think it is interesting, but when I used to teach birthing classes, I would take the moms in one room and their partners in another room.
Yeah.
And And in those situations, a lot of them were male partners, but not
Hmm.
always. Sometimes it was even a mom or a sister or someone who was going to be with them. And
Yeah.
they were both worried about very different things.
Hmm.
And when we came back together to talk, when I asked the mom, what are you most worried about? The list
Yeah.
that they had were almost, at least the person who was birthing the baby,
Hmm.
they were all very similar concerns, and their partners totally different.
Yeah.
And I think that that's what we see in the postpartum period too, is that a lot of those tasks related to motherhood
Hmm.
tend to just sort of fall on the mom,
Yeah.
or the person that birthed the baby is usually the one who's home longer in that initial period. And someone has to kind of go back to providing them income for their house or whatever. And so frequently I see that it is that mom or that person that birthed the baby
Yeah.
who's there trying to juggle all those things. Right. And their partner doesn't, it's not that they don't care, it's just not on their radar
Yeah.
the same way.
Absolutely, absolutely. And I think there's that piece. And I think that's always the struggle throughout, whether that's brand new child or struggle throughout parenthood. How do we see what's going on there? How do we reduce that mental load? And even though we're not the birthing parent, how do we see what's going on there and have these conversations before resentment happens? Because I think that's the biggest thing I notice is, parents start getting resentful of each other because there's not that communication.
Right. Well, and I think for us, at least going into homes to help new moms when they're at home, sometimes it starts from the very beginning of being disappointed about the way their birth went,
Mm-hmm.
or maybe it didn't go as expected or planned. And then from the get-go, they've already just gotten started and they're disappointed in
Yeah.
themselves. And I don't know if you see that, but I can tell
Oh,
right
yeah.
away when I get in there, a mom is grieving
Mm-hmm.
because she had a C-section or she labored for days, 2 days instead of having the baby right away. And so they're already set up for some form of disappointment before
Mm-hmm.
they even get going.
Absolutely.
And I
Definitely.
wondered if you see that as well in your practice, or when do you see moms kind of seeking help from you?
Yeah, so oftentimes I see a lot of moms seeking help when their children are a little bit older, two,
Older?
3, 4 years old, and the resentment has often already been built.
Wow.
And I always say to folks, like, right after you have a baby, it's tough. It's tough scheduling wise, it's difficult, but I think it is so important to have that space to process, especially if you had a birth trauma or it was a very difficult birth, or even if it was an easy birth, like just that adjustment to motherhood of like what you think it's going to look like and what it actually looks like is always going to be slightly different somehow, maybe radically different, but usually some form of slightly different. And how do I cope and accept this new reality, whatever it may be, and if it doesn't match up with what I expected?
Yeah. Well, and I think even from kind of from the new mom perspective, we often see that disappointment and they're trying to get back on their
Mm-hmm.
feet, but also not being ready for how physically
Yeah.
demanding it is when they're so
Mm-hmm.
tired, having gone through a long labor and then they're very tired at home. And from my perspective, the first 2 weeks are literally like a mountain for most parents.
Yeah.
It's a reality shock of getting home with this baby, and the babies are really erratic in their schedules and sleeping and feeding, and moms are
Yeah.
really tired. And I think that I just want to start there because it's normal to feel overwhelmed and tearful during those
Mm-hmm.
times. But from my perspective, if I see what we call baby blues
Yeah.
in those first 3, 5 days, that first week is very normal. And I bet I see it in 99% of the moms.
Wow.
Um, but if it goes beyond that, where we're coming into that 2 week point and
Mm-hmm.
people are starting to feel really tearful and depressed and
Mm-hmm.
not sleeping, and even their partner might say, I'm kind of worried here. She's really different. And
Yeah.
that's when I think that we need to say you might want to consider some things to do. And it doesn't necessarily mean that they need right away professional help, but I think it's where we can open the door and say, a lot of moms start to kind of come around now and things should settle out. And I'm a little worried about you and how you're feeling, and then trying to direct them to get some help. And I guess I wondered from your perspective, if you see moms that are newly home with a baby, and what is kind of the thing that they say that's most surprising to you when you meet them, like
Yeah.
that they're struggling with? Do you see that, what we see in the home by the time they come for therapy, or?
Yeah, so I say usually one of the biggest surprises for moms during the postpartum period is I think how exhausting and how their life is so dramatically
Oh,
shifted from having a baby. I
yeah.
often notice like they think they kind of bounce back often, like do things they used to do, like go to concerts and like go, to social events and feel like they're going to have that energetic self back and realizing what a time commitment and a lot of energy it takes to kind of take care of that baby.
Yeah.
And what that takes. I think that's kind of the biggest thing of like all the work that comes in, you're like, oh, I just, I port them all, I take them everywhere, but it's sometimes not that easy.
Oh my gosh, for sure. And I mean, I think part of what we try to do is say, here are some things that concrete things that you can do to help during this adjustment period.
Yeah.
And we really try to help them look for resources right away,
Mm-hmm.
trying to say, who can you pull in to get some help? It doesn't
Mm-hmm.
necessarily mean that you have to hire someone, but at least I've seen a big change over the past 10 years that a lot of new moms are not near where their family is,
Yeah,
where their mom
absolutely.
is, their grandma, their aunt, their sister, but really helping them identify who could they get to come over to help
Hmm.
them. And sometimes it's friends, family, church resources, something like that, or saying a doula service,
Yeah.
or an agency. Even a grandparent, an in-law might say, we don't know what to get you. And we have people that buy gift certificates for various services. And even just having someone come in and clean your house or do
Yeah.
your laundry and having that kind of help is helps ease some of the load of all of those
Hmm.
things that have to be done. But I also think that when moms are really overwhelmed, I find that they don't even know what to do, where to start.
Again, that mental load, right? You have to also decide where you're going to start. And I
Yep.
think that is the tough piece. And I always say, that non-birthing partner, like encouraging them to say, hey, where do we need support? Like taking that lead and saying, okay, we need help with cleaning. Let's get a cleaner in. Hey, we need help with, a night nurse, maybe for one night a week, just so we can both get sleep at the same time.
Yeah,
I see that a
absolutely.
lot is a big issue is the sleep, and you're not sleeping in the same bed anymore. One parent is up with the baby. Like, if, figuring out where is the pieces that are needed and just taking that initiative and just doing it, I
Yeah.
think it can be so helpful.
Well, and I always get a little bit uncomfortable when the mom says, I don't know how to talk to my husband about this or my
Hmm.
partner. I
Yeah.
really need some help in because I don't want to come off that I'm accusing and I'm
Yeah.
resentful. That word resentment is a big one, right? Where I feel
Hmm.
already resentful that it's all on me. And so I wondered if you might have some tips of how a mom might approach her partner to kind of open
Definitely.
up that communication.
Yeah. So I talk a lot about this in therapy, and I think therapy is a really great place to kind of practice and role play these
Ah,
conversations and figure out what's underneath that. And I always say, like, how can I assertively say my wants and needs? I think that is the thing that people struggle with the most is to directly say, I need X, I
ah,
need Y, in just a very direct manner, like, I am tired, I need sleep. Because the thing is, there's the situation, right? There's what's going on. You're exhausted, you're having a hard time. But what's really underneath that? What is underneath that situation? What is deeper than that? Are you needing that emotional validation or and support? Are you just
mm,
needing practical help of like having your partner, hold the baby while you get take a nap or take a shower? And I think that's the piece of really navigating these conversations of how do I say what I really truly want and need from that person? Because I think there's, we try to guess, we try to mind read, which, we should anticipate our partner's needs, but also how do we say that of what we
yeah.
truly want and need from our partner?
Oh, I think that's really important. I definitely have been caught in those conversations where
Yeah.
the mom will say to her partner, you're not, you didn't.
Mm-hmm.
And really having them say that I need, because I think we all have basic needs that we forget
Yeah.
about when you're overwhelmed, like being able to have a shower or some
Yeah.
time for yourself as a new mom is super important. So even those simple things I think can be so helpful in trying to
Definitely.
open up that conversation. And I think when I go in a home and a mom is very overwhelmed, I try to sit down with her partner, and almost always the partner will say, I didn't know what to do. I had no idea where to
Mm-hmm.
begin. I could do that. I can make this list.
Yeah.
I can take over policing the visitors
Yeah.
because that's another thing that becomes very overwhelming for new parents is all the people that are dropping in that mean well, but you're exhausted and you want to stay in
Mm-hmm.
your pajamas. And so being able to
Yeah.
say, I'm resting for 2 weeks. We're not going to have any visitors. Or if you want to come by, you
Mm-hmm.
can drop food on the front porch.
Yeah.
Those kind of things. And it's okay to say that's what you need. And you're not supposed to be entertaining in the first couple weeks anyways.
Yeah.
And giving them permission that it's okay to not have people over.
Yeah, and to not have to entertain or to say no, to set boundaries. Boundaries actually is funny enough another conversation that comes up so much beside from mental load is how do we set boundaries within our relationship? We might know
Yeah.
as a couple how to set boundaries with each other, but how do we set boundaries as parents? And that's a whole new situation to navigate, whether that's with each other or with in-laws.
Yeah. Yeah. And that's always one that couples, from what I see, struggle.
Yeah.
especially when it involves in-laws, because you don't want to hurt somebody's feelings and
Mm-hmm.
whatever. And but I think it's also an okay time to realize that it's okay to ask for help, and it's also okay to say, I'm just going to be alone with my baby for a couple weeks.
Yeah,
And even simple things like going outside every day, I think really does a lot to help people feel better.
definitely.
And a lot of times I tell moms, if you have a fussy baby and you're alone and your partner's gone back to work, and just putting that baby like on your chest in a carrier and getting fresh
Yeah,
air every day, just really I think is good for your psyche in general.
definitely.
Um, and I can't stress enough that I always try to tell people if they say they have no idea how to connect with new moms, because they often feel very alone, and you might be able to
Mm-hmm.
speak to this more than I can, that
Yeah.
they think they're the only one going through this,
Mm-hmm.
that everyone else seems so happy online with their babies. Everyone is posting pictures on
Yeah.
Instagram, how great and lovely, and it is, but that is also all they're posting. There aren't a lot of moms on there who are posting those overwhelm
Mm-hmm.
and tearful moments. And so I think trying to find people that you can connect with that have similar experiences. And I always try to look at where a mom lives and pull up local moms groups,
Yeah.
so they can get together with new moms. And that's the one place that they should get out to. I feel like after 2 weeks that they should make an effort to go meet these moms. And a lot of them are outside groups sitting in a park.
Yeah.
Um, and I've never had a mom come back to me and say that that was not a good experience.
Mm-hmm.
They always look forward to that connection. And so I think it gives moms just that support that they need from someone in a similar experience. But
Definitely.
I was also curious, do you often find that partners come to you too in group there, like couples therapy, or do you mostly see moms?
Yeah, so I mostly see moms. I like to give moms that individual space and refer out for couples therapy and have that be very separate. As counselors, we can't, either we see the couple as a unit or we just see the mom because
Gotcha.
I want to give that mom my full attention and I want to be on their side and I want to just give them their space to be. And so that's really important to me.
Yeah,
So I am often in the place of like, let's process what's going on with you. I'm not going to be your couples therapist. If you need that, I'm going to give you a referral and get you that support. But how
yeah.
can you, by yourself, advocate for yourself more, prioritize self care, redefine your identity as a mom, and figure out what that looks like for you? And the biggest thing, like you were just saying, finding that sense of support as a mom, it's the one of the most common things I hear is I feel isolated as a parent. I
Uh,
feel like I don't have that sense of support if family doesn't live close by or if they're not as supportive as I'd like them to be. I see moms struggle with that all the time. And I think getting that support is so essential. Having that tribe, that community that you can rely on as a mother is so essential. And just putting yourself out there, being vulnerable, and whether that's a mom's group on Facebook, having a meetup. I don't know if you're familiar with the Mom League, and that's for women with newborns and kind of going up, I think within the first year of their birth and kind of growing up together and kind of having that sense of community. And that's also something I'm thinking about and planning to start soon in my practice is
oh,
having a group therapy for new moms,
yeah.
which is a new offering that I'm planning to do in the next few months of how do we normalize how we're feeling? Because I think there's this piece of we all feel like we're abnormal. We feel like
Oh,
there's
for
something
sure.
wrong with us. And I think just even that piece of normalization of like, okay, another mom's going through that.
Oh my gosh, yes. And I moved here from Virginia, and one of the hospitals that I was affiliated with literally opened up this, it was a basement of an old
Mm-hmm.
house, and they put pillows and chairs in there. And every Thursday for 2 hours, they opened it up for, they called it Welcome to Motherhood.
Yeah.
We had a facilitator there, but it wasn't a medical person. It
Mm-hmm.
was just someone where women came in and sat around, and
Yeah.
if the conversation or people were awkward trying to get started, we might pull a topic up
Yeah.
and just let them. And believe me, we didn't have to do anything.
Yeah.
It just took off. And when the 2 hours was up, no one wanted to leave, right? So
Mm-hmm.
it's a really great thing, and especially if you can do it in person. I think COVID taught us a lot of things, but I think that situation was so isolating for moms, and
Yeah.
we now have that sort of second wave of women who had a baby during COVID
Yeah.
and were so isolated and literally
Yes.
traumatized by that
Absolutely.
isolation. And now they're having another baby and they're finding it is a very different experience,
Hmm.
in a very good way, but also a scary way, right? Because now they can get out with their babies. And so I think having those support groups are huge. And most
Yeah.
every community, no matter how tiny they are, we can help you find one.
Yeah. Absolutely. Finding that place for support and finding ways to manage that social anxiety that's so common after COVID. I feel
Hmm.
like it's so intense for so many people, no matter what the age, life stage you're at.
Yeah.
But finding that sense of support and community is so essential.
Well, and I think that, and just in a time frame, I think I mentioned that the first 2 weeks when we see people is when they seem to be struggling the most,
Hmm.
just with that adjustment to motherhood. But then things settle out a little bit, and then as they move into that 4 to 6 week period,
Hmm.
sometimes moms are still struggling with that new identity as a mom, and that's
Yeah.
when they tend to need additional kinds of support.
Yeah.
And oftentimes I feel like, and this is not to minimize the role that their provider might help, but a lot of women go back at that 4 week,
Yeah.
6 week to their doctor or to their OB or their midwife. And a lot of times they're a little bit embarrassed about sharing how
Hmm.
much they're really struggling.
Yeah.
And it's not that I don't think that medications are sometimes helpful for moms, but I did want to talk
Hmm.
a little bit about that, especially with your input, Dr. Chase, that I think that women need this support so much, this
Yeah.
ability to go somewhere and have a space. And a lot of times providers seem to say, well, we could just start you on this medication.
Hmm.
And I'm not saying that that isn't needed or helpful in some
Yeah.
cases, but the people who I see that really benefit the most are when they get that connection somehow and trying to find a support person, a counselor, a therapist. And I wondered if you might be able to talk a little bit about that journey and how people can kind of find a space. How do you know?
Yeah.
People Google, right? And they're on there trying to find something. And so how do people kind of work through that in the
Yeah.
system?
Absolutely. So a lot of times I see folks, a lot of times I think medication is really important. It's very helpful. I describe it as a way to kind of get ourselves up here, to allow
Mm.
the support we get from a therapist to be more effective. I think
Oh,
both are needed to happen in conjunction with one another. And it's always a personal decision. I always tell my clients, like, I never will push on you. If you want referrals, I'll get them to you. But I think the medication can help us feel, motivate us enough to do the coping skills we need to do or to work towards our goals in counseling. And I think both in conjunction can be really helpful. I'll say that as the first part. The
yeah.
second part I'll also speak to is, how do we find support? What do I even do if I'm feeling that way and I don't know what to do? So there's a really great organization called Postpartum Support International. And they have therapists that are certified, and it's called PMHC, perinatal mental health certification through them. I have the certification, and a lot of different clinicians have that certification on their website. They have a list of folks that are certified there that
Nice.
that they have a specific training in perinatal mental health. And you can even search on Google PMHC near me, or look on their website. That might be a really great place to start to know that somebody has expertise and experience and meets their standards for knowing about perinatal mental health, that that they'll kind of understand where you're coming from.
That's awesome. Well, and I also think sometimes, couples will say that they're worried about the financial burden of getting
Yeah.
help. And again, we find ways to help people work around that. So many
Hmm.
um, families, like in-laws, we have a lot of moms, grandmoms that call us and say, my daughter really needs some help, and how do we get help? And people are willing to help in ways.
Yeah.
People will offer to pay for services. And so I think there are ways to work around that if people are really struggling. And I just think we don't often think about someone giving us a gift card for help or
Yeah.
whatever. And but we even have women in offices that chip together and give a mom a certain amount of money in a gift card for whatever she might want to use it for. And so
Yeah.
there are ways to get around it, and we don't always need stuff, right? We get a lot of stuff for our kids,
Yeah.
but this is an investment in ourselves. And I think there are ways that you can work around it if you really need to try to find that help.
Absolutely. It's an investment in your mental health and your well-being, and that's gonna pay out twofold in like all these other areas of your world.
Yeah.
So I always say that to folks of like, yeah, it's a financial investment, but there's also a piece of like you feeling better and confident and reaching those goals that you're needing to that are gonna pay off in long-term gains.
Yeah. And I mean, I think I talked a lot about moms that are having their first babies, but the other time that we see people struggling is a mom who has a 2 or 3 or 4 year old at home and
Mm-hmm.
they bring a new baby home.
Yeah,
And those challenges are very different than a lot of what we've talked about here. Some
absolutely.
of it relates to the difficulty in scheduling all those tasks because now it's sort
Mm-hmm.
of double. And um, that's a time where we would love to make a referral to someone so that they could get support for their family just in this sort of sibling adjustment into their
Yeah.
family as well. And it sounds like you have some experience in that as well.
Definitely, definitely. I talk a lot with new moms because I think sometimes the transition from one to two is also very different. And how do we cope with that transition? How does it look differently for us? Do I need extra family support? Do I need extra outside support? And what's going to shift more than just, okay, there's two kiddos in the household? So much more shifts there.
Yeah, that's great. I mean, I think we had a couple families that I worked with who ended up going in. The mom went in for counseling sessions once a week, and her partner was already back to work, but
Mm.
they hired us just to be there for 4 hours so that
Yeah,
she could get a shower in the morning, give the baby to someone, get a shower, and get ready and go to this appointment and come back.
yeah.
Right. And so there are ways to do it, and people can support you in a lot of ways in that journey. But
Yeah.
sometimes just something as simple as that, just getting that mom out of the house to get the help,
Hmm.
is a lot.
Absolutely. And if getting out of the house is too hard, that's why I love telehealth. I'm an
Oh,
exclusively
yes.
telehealth provider. And I think why that's so helpful to new moms is you don't have to leave the house. And I tell moms, have your baby in this session. I think having some support, even though it might be a little bit distracting, is better than no support at all. And I always welcome
Yes.
my moms, bring your baby, do what you need to do, be a mom first, but be here. That is, I always say I can meet you where you're at if you're in the car, parked at a park, if you're, in the kitchen trying to do breakfast, whatever you need to do, I'm happy to meet you where you are because I think that is what sometimes we're really needed is people meeting us where we're at as a parent.
Yes. Gosh, that's a great point. So that might even be worth when someone is looking for a provider to see, considering if it's difficult for them to get out with their baby, does the person offer those virtual visits?
Yeah,
Because that's really helpful.
absolutely.
Yeah, that's great. And so then someone, no matter where they are in the country or the state or whatever, could contact you,
Hmm.
right? Or could have that session. They don't have to go anywhere.
Yeah, absolutely. As long as you're in North Carolina, South Carolina, or Florida for me, different therapists have
Okay.
different licenses. But
Yes.
as long as you're in those limits, you can get support, from
Hmm.
anywhere, which I think is really nice to meet clients where they are.
Yeah, that's great. I think it makes me feel better to know that there are some options out there for moms.
Yeah.
And I actually didn't know. I mean, I struggle a lot of times when I'm at a house, literally trying to
Hmm.
help someone find
Yeah.
like the resources. And so having that information is great. And we'll make sure that we can sort of tag that on our website so people have a place to kind of go.
Absolutely.
And it's helpful, I don't know, but anyone who's ever thought they need to talk to someone, you're on the phone trying to find someone who has experience in what you're going
Hmm.
through. And so that particular sort of certification or training, I think is really important.
Yeah, absolutely. Because I think it's just that feeling of feeling seen and understood. And I think that isolation is the most common thing I see among new moms is feeling of I am alone and nobody understands.
Oh,
And feeling
absolutely.
seen and feeling like, hey, I get what you're going through. It's so difficult. And let's figure out some ways to make it a little bit lighter.
Hmm. Yeah, that's great. Super helpful information.
Yeah. So tell me a little bit from your experience as a nurse and a doula, what is one of the biggest surprises that most moms share during the postpartum period?
Um, if we can get them to kind of, if I get a little relationship with them, usually if I go a couple times, they start opening up about, you know how you said there's always what's underneath?
Yeah.
like what you're seeing. And I think that that's if you can really get to know someone and they trust you, then they start
Hmm.
sharing literally how overwhelming that it is. And
Yeah.
honestly, that they don't necessarily say, I regret having the baby,
Hmm.
but that it's so much more difficult than what they ever thought.
Yeah.
And that's with a lot of moms. And being able to say to them, that is so normal.
Yes.
This is so normal, right? And and most of them start crying, right? I thought I was alone. I was afraid to even say it out loud. I really wanted this baby.
Hmm.
Maybe they've been a fertility patient for 10 years and they finally get
Yeah.
this baby and they're like, oh my gosh, what am I complaining about? Right? And just being able to validate that and say, almost everyone goes through this to some degree or another. Right. And so I think I was surprised at how many moms feel the same way.
Yeah, and I think it's a thing of we just don't realize. A big thing I see a lot in new moms is like intrusive thoughts. So having these unwanted
Oh,
thoughts about what's going on with us. Are we having worried thoughts about dropping our baby or hurting our baby? And we feel this sense of shame and guilt in a lot of having these different thoughts. And it's really important. How do we address that? I think there's a difference between intentionality and a thought. And if it's unwanted, I think that's the biggest important part of normalizing that. Okay, now what do I do if I'm feeling really anxious that I'm going to accidentally drop my baby?
yes, I know. That is a really good point. And I think if I get to see a mom enough and I'm in her home enough and I
Mm-hmm.
start seeing those kind of signs,
Yeah.
and I don't want to necessarily use the word paranoia, but for me, it sort of is those thoughts where they're very extremely worried about
Mm-hmm.
things.
Yeah.
Trying to just sort of show them what they can do that's safe. And if it continues, that's when it kind of helps me be able to say, I think it'd be really good if we reached out and got you some help.
Yeah.
And actually, I've never had a mom say, no, I don't want to do it. They're most always, they see it too on some level.
Mm-hmm.
So that's a really good point.
Yeah. I think it's just really important of knowing like what is, I think the idea of normal versus not normal. People always talk about and like if it bothers you and it's a problem, it's a problem. And you can
Yes,
get support for it. It doesn't have to be this big thing. There doesn't have to be a big meltdown. There doesn't have to be a big explosion. If you are feeling overwhelmed and you need support, that's enough.
absolutely. Yeah, that's a great point.
Yeah, yeah, absolutely. How do you feel like in your experience, you know, how can partners and families kind of help share this load more equally?
Yeah, I think kind of back to what we talked about a little bit in the start. I think
Yeah,
literally when I go in, I try to look at even the setup of their house and talking to them about
yeah,
what feels overwhelming and what isn't.
mm-hmm,
Um, and even the mom saying, I'm so tired, I can't think about any of this, right? But
yeah,
getting her partner, and I'll say, listen, can we make a list of 5 things that you could do that she's overwhelmed with?
yeah,
And again, I've never had a partner say no. They're usually
mm-hmm,
like, I didn't even know where to begin,
yeah,
right? So just helping them make those lists of things that they can do and somehow just getting that started with them
yeah,
kind of shows them right in front of them what those tasks are and getting the
mm-hmm,
partner to help out. Again, I think it reduces that sort of resentment that mom feels like
yeah,
she's doing everything, but kind of making those lists. And if getting extra help, like we talked about, getting a laundry service, a cleaning
mm-hmm,
service, a nurse or a doula in there a couple days a week
yeah,
makes a huge difference in sharing that load, whether
yep,
it's the mental load of everything and the physical load, but it makes a
mm-hmm,
huge difference even for the first month or so
yeah.
until they kind of get back on their feet.
Absolutely. And I always say there's a really great resource called Fair Play. It's a game and it's also a book by Eve.
Oh,
I think Rodsky is the last name. And it's a really great book that like kind of focuses on the mental load of parenting and the different tasks. And it really encourages parents to take different tasks and own those tasks. And it might change day by day and week by week, but really understanding like what are all these different tasks, both mental and physical tasks that parenthood involves.
yeah. Yeah, that's a good point. I had a family who the dad is a data kind of person, a very detailed
Mm-hmm.
person in his
Yeah.
job. And this isn't a plug for this product, but it's one of these electronic calendars that you put
Yeah.
like in your kitchen.
Yeah.
and utilizing something like that to really load that up with all those things so
Mm-hmm.
it's right there for everybody to see, and then
Yeah.
having someone take ownership of those things, but just helping
Yeah.
them get organized in some way.
Can be so helpful. Just like
Yeah,
little things of having I always say a family to-do list, a
yeah,
family calendar, having some kind of shared communication where you can just put it down. You don't even have to communicate it verbally to your partner if there's a thing, just to
yeah.
keep things a little bit easier and reduce that tension.
Yes, I agree.
Definitely. Awesome. Wonderful. Um, I was looking at the next one. Let's see. Why do you think moms often feel they must do it all, even when support is available?
Yeah, this is a tricky one for me because it's probably going to appear that I'm anti-social media, but I'm not. Um, but I have to say, I literally have moms that will say, all of my friends are saying
Hmm.
this, or they're posting all
Yeah,
of this. And I just think social media makes it so much more
yeah,
that we have to compare ourselves to. And I've seen a big change in 5 years in how people
hmm,
perceive how they're doing and their abilities. And I do
yeah,
think having that out there for everyone to see is just puts more pressure on us to compare
yeah,
ourselves to other people.
absolutely.
And I do think it can be important, but I do joke with moms and say, get off that, right?
Yeah,
Just don't do that right now. And because I promise you, not everybody's life is that perfect,
hmm,
right? And so I think for whatever reason, we do see so much more of that right kind of in our face.
yeah,
The pressures of, am I doing as well as everybody else? And why is their baby sleeping more than mine? And
yeah,
why am I so tired? And, just trying to normalize what's okay for you, right? You're
yeah.
fine.
All that comparison game, I think, is really hard with social media. This idea of being the perfect parent. The perfect parent doesn't exist. They take that pretty picture and then they get spit up on it, or whatever it may be. We always put the good things on social media,
Yeah.
but the day-to-day hard things when it's tough and it's difficult, we don't really talk about. And so realizing like reality versus what's on social media can look very, very different.
Yeah. Oh,
Definitely.
for sure. Yeah, I agree.
Yeah, absolutely. Definitely. Yeah. Awesome. Wonderful. I think we had a really awesome conversation. It
It's
sounds
great.
like, you know, I really love how you all support the family from a doula perspective of giving them that round the clock care, whether that's at night or daytime or with those day-to-day tasks to help lighten the mental load for both of those parents. And I think that piece is so deeply important.
Yeah, I appreciate that. And I think, honestly, the number of like families, like grandparents that call our agency and live in another
Yeah.
state and say, I'm really worried about my daughter
Hmm.
and can we get some help in there for her? And so I think sometimes moms can't make that call
Yeah.
themselves, and a friend or someone else might be able to do that for them. And sometimes just even having us in there saying, hey, we need to reach out and get you some help
Yeah.
is just a great way to support a new mom.
Yeah. Hopefully, this conversation was helpful to everyone that was watching, and I hope you gained some stuff from it. If you have any further questions from the mental health perspective, or if you are somebody that's seeking some support, feel free to reach out to me, climbinghillscounseling.com or my at Climbing Hills Counseling on Instagram. Always happy to schedule a consult call and support any new moms that are looking to seek support, aren't sure where to start or how the therapy thing even works. We can talk it through and I can hold your hand through the process.
That's awesome. Yeah, thank you. And again, um, the Queen City Doulas website is not just about hiring a service or getting that help, but there's a lot of great resources on there.
Mm-hmm.
And we'll put that link on there as well for moms that are looking for some additional support.
Awesome. Thank you so much.
Yeah, thank you. Great talking to you today.
Absolutely.
All right.
Bye.
Bye now.